Hello, good morning. My name is Bente Mikkelsen. I'm head of the Secretariat of WHO's Global Coordination Mechanism on NCD, and I'm here today to launch a new community of practice, NCD, non-communicable diseases, and the next generation. WHO Global Coordination Mechanism is setting up several communities of practice with the purpose of support governments to implement actions from the Global Action Plan on Prevention and Control of NCDs, and also to achieve NCD-related targets in the SDG agenda. The communities of practice is networks of individuals that will exchange expertise and knowledge. If you're interested in joining up with any of the communities of practice under the Global Coordination Mechanism, please visit our web pages and make your interest known. The first virtual discussion is in the community of practice of NCD and the next generation, and the topic will be Getting to 2018, how to engage youth as change agents for tackling NCD in the next generation. The preparatory process for the UN high-level meeting is ongoing, and an outcome which is needed is a new roadmap to guide governments and countries on how to tackle NCD for the future. Today's youths are already leaders, and they are also the future leaders and also the carriers of the brunt of the NCDs, both financially and personally. Furthermore, youths are specialists in being youths and have a different perspective and a renewed perspective, and hopefully new innovative solutions on how to tackle NCDs for the future. We sincerely hope that you will find this platform useful as an exchange for expertise, as an exchange for learning, maybe to define innovative solutions already now, and also to support the implementation and the definition of the new roadmap for the future to prevent populations against NCDs. So, either if you are an academic, if you are a professional, an advocate for NCDs, please join our community of practice. Hope to see you there. Thank you.
Hi, my name is Jordan Jarvis, and I'm the facilitator of the steering group for this community of practice on NCDs and the next generation. I'm also the executive director of the Young Professionals Chronic Disease Network. We're a global nonprofit and advocacy organization that's focused on mobilizing students and young professionals to address NCDs as a matter of social justice in their home communities as well as online. Now, in 2011, alongside the UN high-level meeting on NCDs, we held the first ever youth rally on NCDs just outside of the UN headquarters. And we called on our governments to demand equity, action, and targets on NCDs. In 2018, our governments are going to meet in New York again to discuss the progress that has been made on NCDs since the political declaration in 2011. As the next generation of practitioners and leaders in the field of non-communicable diseases, we must be at the forefront of the policy discussions, of the action, and on the efforts for accountability on NCDs. If we don't hold our governments and other stakeholders accountable, then who will? I'm really looking forward to your contributions and insights throughout this community of practice on how, together as a community, we can create an action plan toward 2018. Now, some of the discussions that will guide us there will involve gaps and opportunities on training for NCDs globally, on grassroots advocacy, what works, what doesn't, what are you doing in your community, as well as accountability. What does it mean and how do we build accountability? Thank you so much for joining and look forward to your contributions.
Hello everyone, my name is Melanie Merkel. I'm the African coordinator for the Young Professionals Chronic Disease Network. I'm based in Nairobi, Kenya. Today I'm here to welcome all of you to the community of practice on NCDs and the youth. And we're all working towards the year 2018. In just about 18 months, the United Nations is going to convene a General Assembly, and one of the things that they'll be discussing, very key things, is on the progress for non-communicable diseases. We as the young people have a very important role here to play in terms of accountability, in terms of saying what has worked and what has not worked, in terms of even bringing in innovative solutions that can be discussed come 2018. I therefore call on board all the young people, all the young professionals, all the youth advocates, and everyone in general, from north to south. Let's all come on board, discuss all this, so that come 2018, we are on the table discussing the issues and not just there to be seen, but there to be heard. I look forward to having very fruitful engagements with all of you. Welcome on board.
Hello everyone, my name is Marie Hammerstow and I'm part of the Danish chapter of Young Professionals for Chronic Disease Network. In the Danish chapter, we try to build partnerships with other chapters of YPCDN, especially the East African ones, to fight NCDs at the global level. As well, we aim to work more at the national level to try to make better policies for NCDs at the Danish level. Furthermore, I'm also a medical student and I'm part of the International Federation of Medical Students Associations. And here in Montenegro, we just had an NCD youth caucus where we gathered expert speakers and we discussed in big groups of medical students how to fight NCDs and in the different contexts, and also relations to urban health, primary health care, inequities in NCDs and universal health coverage. So the outcomes of all of these discussions were really our now existing Budva Youth Declaration, a call to action on NCDs. And here you can see the different calls to actions that we have towards all of the different stakeholders. I hope that this document and this youth caucus and all of our efforts really will create a youth movement towards the high-level meeting in 2018, and that our community of practice can take part in fighting this battle. Thank you.
Hi, my name is Ishu Kataria and I'm the Global Coordinator for the Young Professionals Chronic Disease Network. The Young Professionals Chronic Disease Network is a global non-profit that works to mobilize young leaders worldwide to take action against the social injustice driven by non-communicable diseases. At YPCDN, I work with local young community leaders at grassroots levels, which includes both young professionals and students, to do advocacy campaigns on non-communicable diseases and access to medicines. For non-communicable diseases, 2011 was a landmark year where the global burden and threat of NCDs was echoed by member states as one of the major challenges for development in the 21st century. We, at the Young Professionals Chronic Disease Network, came up with the first youth manifesto on NCDs, framing it as the social justice issue of our generation. As we move towards the 2018 UN High-Level Meeting on NCDs, this community of practice presents itself at an opportune moment to have you, me, and the youth across the globe to have a say and to be heard. I welcome you all to join us in this effort.
Hi there, my name is Jack Fisher and I'm the Global Coordinator for NCD3. And NCD3 is a global social movement which aims to use innovative ways to communicate and advocate for around the topics of non-communicable diseases and global health. And ultimately we do this for a wide variety of platforms. This includes our social media, our short films, our campaigns and our events. But ultimately all of these activities try to crowdsource solutions and perspectives from a wide variety of young professionals and students, not only from the world of health, but also from other non-health disciplines such as architecture, business, design, and many, many more. Ultimately, we're very happy to support Communities of Practice, which is launched by the GCM, because this is a great platform for you to share your perspectives and solutions around these important topics in the lead up to the 2018 high-level meeting on NCDs. So we welcome your perspective regardless of your background and regardless of wherever you are in the world. We hope you can contribute openly to this discussion and we look forward to hearing your perspectives over the coming weeks.